Dr. Eric, the fitness physician, where I discuss all things related to hormonal fitness and muscle medicine and much, much more. To answering a couple client questions on testosterone, this comes up quite a bit, and we've talked about this before in terms of applications, doses, or routes of administration, what's best, some pros and cons, etc. I wanted to give a couple more graphic examples as well. Too, one of the things we talk about is trying to mirror our body, right? We will use bioidentical hormones that match exactly what we make, not a synthetic version. And we want to try to mirror our body's normal rhythms, right? It's kind of like our diurnal rhythms, similar to like when we give secretagogues at night. We want to match the normal rhythm of growth hormone production, not give it artificially at the wrong times, too much, too little, etc. Same with testosterone and all the hormones. We want to kind of mirror our body's rhythm. So one of the things when you look at absorption and actual modes of administration, a lot of times in the old days, guys would get big doses of testosterone every couple weeks or once a month or something like that, or even with, for example, pellets, which they work a lot of times, but other times not as good. It just depends on the person. So if you have your levels here, and again, I'm just making up arbitrary numbers here, but say the low end of here, say like 300 up to 1,000. Again, oftentimes you start off low, and then when you give a big ass dose, it goes way up, and then it slowly drops and gets below. And you can get these spikes sometimes, and oftentimes that's where the side effects happen, when you get too much at once and very quickly, and that's when you get some side effects, and you can get some erythrocytosis and things of this nature, and it slowly starts to drop, and people start to feel it, because your levels are dropping, they're getting below where they need to be. And so we've tightened that up. Oftentimes what I typically do with injectables now is typically do it once, twice, or even 3 times a week. Some guys even do great on daily injections. That's truly the most physiologic dose, because we make testosterone every day, right? So we want to mirror those rhythms. So if you're going in those injectables, or I'm going to talk about creams in a second, we can mirror those rhythms. So for example, with a cream, you can do a daily application, and basically you're applying it every day. And yeah, it goes up and down a little bit, but you're staying within that range. It's staying in that physiological. So that's the most physiological application, is truly with the cream, whether it's elsewhere on the body or actually scroll application. Works really well in men, and keep it in that tight range. A lot of guys don't like this because it is a daily thing. You have to be conscious of transference, meaning giving it to kids or spouses and things like that if you're getting too close to them for the first hour or two after application, or it's just a convenience factor. Some guys just don't want to mess with it every day, just want to do an injectable because it's once a week, twice a week. As I mentioned earlier with injectables, the next best thing is to do a very mini dose every day, and you'll mimic this pattern as well, which is really cool. Other guys just don't like that, or don't do as well, and we'll do it, like I said, 2 or 3 times a week. Occasionally we'll do it once a week. It just depends. There are some things to look for in the history, on your physical characteristics, things I can pick up on a history and exam, as well as a couple key pieces of information on the lab work, which will clue me in as to your metabolism, how well you metabolize testosterone, fast, slow, etc. Plus we take into account the other things like lifestyle, adherence, and things of this nature. So a lot of different things that come into play with this, but everything works, but there's just a question of making it, how good can we get in close to physiologic that also fits your lifestyle. So again, that's some of the nuances of medicine. So creams and sub-Qs, some other things too, of course, they both do a great job on raising your testosterone and your estradiol levels. Of course, they both raise both very well. So, and again, there's nuances. Some are better than others, and again, it depends on the individual. So both very good at that. Obviously, the cream has, when you're applying it to the skin has more 5-alpha reductase enzyme, of course, in the skin, so you're going to get more conversion to DHT as compared to the injectable. So as I talked about in a previous video, that's not a bad thing. A lot of the beneficial effects that you feel is from the DHT, the energy, the libido, etc. Of course, a lot of guys worry about hair, kind of get hair loss with it. Once again, I talked about this before, but typically no, studies really don't indicate this. A lot of anecdotal reports will say, yes, it does. It's more of a genetic thing. If you're genetically predisposed, will it speed that up a little bit? Yeah, it probably will. But if you're not, then you're not. If everybody in your family has to have full head of hair until they're 100, you're giving yourself topical testosterone, you're not going to get hair loss. It's just not going to happen. So again, very well tolerated and very safe. So, but those are a couple other little nuances too. There are some differences to take into account. So hopefully you enjoyed this, guys. Reach out. Anything you want to learn about in terms of hormone and health optimization, reach out to me, ping me, message me, let me know what you want to hear, and I will talk about it. Share my message, share and like my pages, and get the word out. Let's get optimized. Let's feel great. Let's feel good about ourselves. Let's live to give. That's my message. Everyone have a rocking day. We'll talk to you soon.